Good afternoon, everyone. This is Olivia Marquez, Research Coordinator for the NCCMT. I'm also Coordinator for the Spotlight webinar series, which is brought to you by the National Collaborating Center for Methods and Tools. Thank you to those who have joined us this afternoon for the Spotlight webinar series. Today, we will be featuring evaluability assessments in public health. So we'll quickly review just a few housekeeping items before we get started today. Please see the chat section on the bottom right-hand side of your screen in WebEx. Please post any questions or comments you may have during the webinar here. We'll have a designated open Q&A session at the end of the presentation, but please feel free to post any questions or comments that you have during the webinar, and we'll answer those as we move along. Please post your questions to the chat section and post your comments to all participants, as other participants may have the same questions as you. Today, we recommend using a wired internet connection as opposed to wireless, and if you have any connection issues, you can use the WebEx 24/7 helpline, and that's posted on the slide here right now, and we'll also have this posted in the chat section. We have Vivian available to assist with any technical issues that you may have today, so please feel free to send a message to Vivian through the chat section today. After today, the PowerPoint presentation will be made available in English and French. The English audio recording will also be made available on NCCMT's website. So these resources can be accessed using the links that will be posted in the chat section. And we'll try to make sure that these are posted within a week of today's presentation. We have our first polling question today, and we'd just like to get a sense of the audience that's joining us. So we're wondering how many people are watching today's session with you. So please indicate if it's just yourself or if you have a few folks who are joining with you in a group. So you can answer this question in the poll question panel on the right-hand side of WebEx. And just remember to hit submit when you're done. So thank you to those who have started to respond. We see that most are joining themselves, and we have one who's joining in with a group. So that's really great to see. Thank you. So I'd like to officially welcome everyone to the NCCMT Spotlight on Methods and Tools webinar series. This is our 35th episode of the Spotlight webinar series, and we're featuring evaluability assessments in public health. We'll be posting links to the registry page for this tool, and we'll also have links for the website in the chat section as we move along through the presentation. So today's webinar will include a presentation by Laura Leventon, and then we'll move it into a presentation by Laura Kettle-Kahn, who will go into more of her experience with the tools themselves. So for those of you who may not be familiar with the National Collaborating Center for Methods and Tools, we're one of 6 national collaborating centers across Canada funded by the Public Health Agency of Canada. So we here at NCCMT are located at McMaster University in Hamilton. While the other NCCs across Canada focus on the use of research evidence in specific public area content areas, we here focus on improving the access to and use of methods and tools for health professionals in practice within Canada. We're not content specific, but we offer methods and tools that can be applied across different areas of public health. So the NCCMT has many products and services that are available through our website. These are just a few of the products and services that we offer here on this slide. Many of you may be familiar with some of these, and today we will be highlighting a tool that is located in our registry of methods and tools. So that's at the top of that slide. And note that the NCCMT also offers a variety of other online learning opportunities through online modules. We offer links to Public Health Plus and a variety of other multimedia tools for you to use. We encourage you to check those out as well. We have our second polling question for today. So we're wondering how many of you today are familiar with the method or tool that we're discussing. So either maybe you might not be familiar at all, you've heard of it, or you have actually used it. So again, we encourage you to respond in the poll section of WebEx, and just remember to hit submit when you're done. So thank you to those who are responding. We have a few who are not familiar, so that's great to see that those folks are joining us today. And a few of you who have heard of it, and a few of you who have actually used it, which is really great to see. All right, so I'd like to formally introduce our first presenter for today. It's my pleasure to introduce Dr. Laura Levitin, PhD from she's a senior advisor for evaluation at Robert Wood Johnson Foundation, and she's joining us from the States today. So thank you very much for joining us, Laura. Take it away.
Okay, do I have control now over the slides?
So I've just passed that to you, Laura. So now we can flip this. Perfect.
Very good. Good afternoon, everyone, or good morning on the West Coast. Et bonjour aussi à nos collègues francophones. Don't imagine I speak very much French, so we will try to get by. I'm delighted to speak with you today about the strategy and evaluation called Evaluability Assessment. And it helps to clarify, even for those who are familiar with these terms, the difference between evaluability assessment and some of our conventional terms for evaluation. Summative evaluation being designing and using evaluation to judge merit. Formative evaluation being the design and use of evaluation to improve intervention. And evaluability assessment, which is often termed a pre-evaluation activity to assess whether an intervention is ready to be managed for results, what changes are needed to do so, and whether evaluation would contribute to improved performance. Sometimes people believe that evaluability assessment is evaluation itself. That is not the case. If one were to use the methods that often are employed in evaluability assessment to actually conduct evaluation, it would be a rather poor evaluation for reasons that we can explore later or in what follows. But in particular, the people who are participating in evaluability assessment, the program managers, the practitioners, sometimes confuse these two. So it's good just to know that people may become apprehensive for that reason. Some resources that you may want to turn to if you want more details. Joseph Holy and his colleagues, Harry Hatry and Catherine Newcomer, really developed this strategy in the 1970s. And their version of it is described very well in the Handbook of Practical Program Evaluation. Actually, there is a new edition of the handbook. It is certainly one of the evaluation resources I can strongly recommend. Laura Kettle-Kahn and I have done some pretty significant writing ourselves on evaluability assessment. In fact, I let Joe Holy know that I probably, at this point in time, have done more evaluability assessments than he has, and he agreed. Of course, he was trapped in the elevator with me and wanted to be polite. But much of this work is summarized in an article in the Annual Review of Public Health of 2010, I believe, and in a monograph that we wrote for New Directions in Evaluation. And the Chapter 3 in particular we think is useful for the practitioner because it contains some templates and procedures and checklists that you may find helpful. One moment. Here we go. So what is the reason we should consider evaluability assessment as a pre-evaluation activity? the truth is that for most evaluation practitioners, most of the time, evaluations are handed to us, as in, here, please evaluate this. But actually, many of them just aren't very good. And so it would be helpful, both for reasons of cost effectiveness and just the avoidance of heartache, to tell you the truth, to know in advance whether a program or a practice was ready for evaluation. And in fact, most aren't. It's surmised by some of my colleagues that maybe 95% of interventions are not fully developed at the time of evaluation. And if they're not fully developed, that means the strength of the intervention, the reach of the intervention, the cost of the intervention is just not going to be where we would have it be. Also, there are ongoing problems with logistics for measurement, design, and analysis. In 2001, Wilson and Lipsey reviewed 319 meta-analyses where they found that they looked at the proportion of effect sizes that were associated with study features, and many of these, of course, were evaluations that they were looking at. And they looked at variance accounted for. Most of the variance was accounted either for study methods or features of the intervention, the biggest sources being research design, operationalizing the independent variable, and sampling error. But when you've got problems with features of the intervention, there's no reason necessarily to proceed because the likelihood of its being affected is so greatly diminished. So the moral is don't rush to summative evaluation because often it's just not cost-effective practice. In my own experience, I find that good outcome studies are the culmination of careful work to create interventions that are strong enough, that are relevant to the target population, that are intensive enough, that are of enough duration, and that have enough reach. So you could start with formative evaluation, or better yet, evaluability assessment, since it is a fairly rapid way of finding out where and how you might need to adjust your expectation. The steps in evaluability assessment have long been codified, and they're helpful to think of as steps until you actually get into the work. And we'll talk about some of the discoveries that you encounter later. I have taught evaluability assessment as a part of evaluation classwork to about 100 Masters of Public Health students. And it turns out that they don't fully appreciate these steps until they're actually doing the work or reflecting on work they've done. So you want to involve the intended users of evaluation information. And this is important since really one of the only justification for evaluation is that it is used by somebody. You want to clarify the intended intervention, since there may be many aspirations for the thing that's being evaluated, and knowing those differences in aspirations can itself be a very helpful exercise. You want to explore intervention reality, or as we say, kick the tires, find out what's real about it. You want to reach agreement on needed changes in activities or goals, and often you will find that that is the case. My colleague Laura Kettle-Kahn will talk about a range of activities that really, some of them were almost perfect and we could simply proceed with evaluation, but others really required some discussion, some technical assistance to people in a variety of ways. You want to explore alternative evaluation design, and by looking closely at the program and on data available and so forth, you will discover that sometimes some designs are more feasible than others. And that is consistent with planning for evaluation. And you want to agree on evaluation priorities and the intended uses of the information. Now, this is treated as a linear process, but in our experience, it really is not linear. It may have a start and an end, but in truth, it's cyclical, and that probably is much more consistent with decision-making processes in the real world than a linear construct would be. And so this is, I don't want you to have to squint at this figure. And so in the next slide, we'll talk about some of the early steps in evaluability assessment. We want to involve the end users of evaluation. There may be some primary users, but sometimes the users will surprise you. That has happened to me several times in my experience. And you may discover over time that there are some users of the evaluation that you had not anticipated. So in point of fact, in this work, there's yet another sort of cyclical arrow here that isn't represented. You want to determine the scope of the project. You want to review program documents, consult stakeholders, and come to agreement on the goals. That's the diamond at the bottom of the slide. If the answer is no, in other words, there's no agreement on goals, or perhaps even on what the scope of the project is, what is this intervention that we're talking about, then it really is imperative to do some more consultation before going any further and to provide that feedback to the program manager or policymaker. And if nothing can be done about it, then for the sake of cost effectiveness, you might simply want to stop. A good example of this from my academic years, in the city of Birmingham, Alabama, you may remember they were some of the, they were really a sort of center stage for some of the civil rights episodes of the 1950s and 60s in the U.S. And the Birmingham Arts Alliance had decided the Birmingham schools had to cut out arts education. Well, we want to step forward and provide some experiences in the arts to Birmingham school students. And this was great. You know, on the face of it, it's a good thing to do. You had dance instructors involved. You had artists, painters, sculptors with studios. And the kids could visit the studios after school or the art museum to see what some of the production looked like. And it was people really liked it. However, people had different aspirations for this very nice program. The Birmingham schools loved it because they had to cut out arts education, right? The city fathers liked it because it was going to be good public relations for a city that had been mortified for 15 years or 50 years over their reputation in civil rights and racism. The people who conducted programs to prevent behavioral risks in troubled youth loved it because it was something that could keep kids busy after school, as in idle hands are the devil's plaything. And so if they were busy with arts, then they wouldn't be using drugs or getting pregnant or being juvenile delinquent. In essence, this program, which was otherwise good on the face of it, was supposed to heal the sick and raise the dead. And furthermore, nobody agreed with each other as to what the goals of this program were supposed to be. Now, if you were to take this early steps literally, you would probably have to stop at that point because you couldn't get agreement on the goals, and everybody had these massive aspirations for what the program was supposed to do. Nevertheless, we proceeded at their request, and we kicked the tires, so to speak, on the program. We reviewed program documents. We consulted the stakeholders. We talked with them about their goals. But then we reviewed program reality, and we created a logic model and a theory of change about what this program was supposed to do. We did get actually agreement on the model within reason, which I'll talk about in a minute, in that kids had to get on church buses that were being volunteered to take them to these artist studios. And once they were at the studios, then they received this instruction and good things were supposed to follow from it. Now, let's back up just a second. It is important to review these program documents and to create a logic model or theory of change, but it is never sufficient. And in some of my reviews of practice in evaluability assessment, particularly in development evaluation, I have been dismayed to see that evaluability assessments would be conducted only through program documentation. Well, those documents are going to be so different from the reality on the ground of what is actually provided, particularly as you get into lengthy distances, logistics of providing services, cultural differences, the meaning of these practices and interventions, and the potential results that not visiting to, or at least interviewing service providers and recipients is simply not sufficient. But back to my example. So what are the steps in logic models? I'm sure you've seen some of this previously. You start with inputs, in this case, the resources for arts projects that the kids might undertake, the staff, as in the volunteer artists who were reaching out to these children, the school buses that would take them to the studios, and the students themselves with all of their experiences and so forth. Outputs would include activities such as outreach to the target group or classes that they attend, or transportation of the children to the art studios, or products such as the target group participation. And then outcomes, and we talk about short-term, very near-term outcomes, intermediate objectives, and long-term objectives and outcomes. The theory of change expands on this in that you are starting to talk about why it might be the case. Why would a goal be accomplished? Was the strategy achieved? Were the participants in the target group? did the activities result in the outcome? So building a theory of change differs from logic models in the sense that you are looking into the mechanism behind the changes in this linear process. Or as some of my colleagues say, you talk about it in terms of the so that phrase. The kids get on the church buses so that they can get to the artist studios, so that they can get engaged in an arts project, so that they can have an experience in the arts. Now, the later steps in the process. We create the logic model or theory of change. We find out if people agree on the model. We then interview staff. We scout the program reality. And this turned out to be this particular step turned out to be very important in terms of people's understanding of this model. And you'll be very amused when I tell you about two of the examples. You have to get on the church bus before you can get to the studio. But the churches were understandably concerned about having the most at-risk kids get on the bus because they didn't want their buses vandalized. So if you're hoping to prevent juvenile delinquency with this program, the very kids who are most at risk are not getting on the bus. So everybody heard this and scratched their heads and sort of revised their thinking, or not. In addition, by scouting the program reality, we came to understand that there were limited slots on the bus. There's limited seats. So it was a very popular program, and the children would run to the bus, and at some point, all the seats are taken on the bus. When the dance instructor understood that this is what was going on, she finally also understood why it was that her students were so athletic. Now, we presented this information to the arts program of Birmingham, and they said, well, we understand all those limitations, but we still want to achieve all those goals. So at that point, we had to say, you're not ready for evaluation. You're not even ready, to tell you the truth, for really understanding what this thing is supposed to achieve. But what we can tell you is that it is good public relations for the city of Birmingham, and the kids really like the program. However, we would venture to say that you need some program development if you intend to achieve some of these other aims that you've indicated, such as preventing risk behavior in the kids. Now, down at the bottom, you see a series of items for report. The plausibility of the logic model or theory of change is a big one, and I hope that my example has illustrated for you how sometimes these things just aren't as plausible as you would like if you're going to invest resources in evaluation. They also can fairly quickly and without expending a lot of money for data collection point to areas or potential areas for program development. They can quickly point to evaluation feasibility, options for further evaluation, and a critique of any data that may be available. And when my colleague Laura Kettle-Kahn speaks to you, I'm hopeful that she can talk a bit about data that programs had been collecting that were available for potential use in evaluation. So the next issue is, what next? What's notable in the practice of evaluability assessment is that often evaluation doesn't follow. And if you recall the point that my colleagues were making about that most of the interventions that are out there are not ready for evaluation in one way or another. That's understandable. On the other hand, what we have discovered, and Joe Holy actually agrees with this, is that it is a very good method for intervention development, technical assistance. In fact, our Centers for Disease Control, with Laura Kettle-Kahn's leadership, have really taken this method and offered very good and useful technical assistance to the programs that we've looked at using evaluability assessment. You can also, using this method, start to pinpoint the kind of data collection that would inform improvements. And it also tells you a bit more about when to do summative or outcome studies, namely when the logic model or theory of change is sharpened and agreed to, when the model looks like the reality on the ground, and vice versa, when it's plausible to achieve the outcomes, and when formative evaluation indicates that intermediate steps are being accomplished. Now, some of my proudest accomplishments in evaluation have been when these criteria are met or when I've helped to bring them about. A short example, not having to do with evaluability assessment as such, but the Robert Wood Johnson Foundation funded the PlayWorks initiative to provide organized play to schools during recess, lunchtime, and after school, particularly in inner city school districts that were poor. And the reason that it was done is some kids have never had the experience of organized play. It is a very popular program with these school districts because it turns their recess and other playtime for students from being a liability because they're beating up on each other sometimes because they're bored and don't have anything to do, into a real asset because children can learn conflict resolution, they can have fun, they can be physically active. We eventually did a randomized, place-based randomized experiment on schools that were using the PlayWorks model, which was delivered with very high fidelity, and schools had accepted the idea that, well, there are, limited coaches for the organized play available, and we really want it, so we understand and we accept the idea of being on a wait list for the intervention. We discovered we had good indications in advance that this was likely to work, and it was because of some preparatory studies we've done indicating less bullying, more physical activity, more conflict resolution, and the teachers just loved it because children were ready to settle down when they came back to the classroom to resume work. So because of those preparatory studies, we measured all those things, and we discovered from teacher self-report the largest effect size on prevention of bullying among the available randomized controlled trials. So that makes me very proud. All of that preparatory work really paid off, but I'm sold on the idea that evaluability assessment could be an important part of that preparation. Thank you very much, and I think now we're ready to turn it over to Laura Kettle-Kahn.
Good afternoon, everyone. It's really a delight to be asked to share some information and experiences with all of you. As you know, I've worked with Laura Levitin in the past, and so it's always fun to give a presentation together. So what I'm going to do this afternoon, excuse me, is give you some very specific examples of the systematic screening and assessment methodology that was a process that we came up with in a project that I worked on with Laura Levitin a number of years ago. And what's exciting to me is that from that original experience, this methodology has really been well received in the field. And so what I'm hoping to do today is show you some examples of how it's been used. I've got 4 examples that are really pretty different from each other. The first is the community obesity prevention, which was really the cornerstone experience for the development of the SSA methodology that is centered on an evaluability assessment or around an evaluability assessment and resulted in the evaluation of the New York City child care policies for nutrition and physical. The second example is a healthy eating and active living example from some colleagues that worked on this at CDC, as well as a hypertension control example also from CDC, and then traumatic brain injury, and those are all CDC examples. And then the final example is a little bit different, and I'm not going to tell you why it's different at this moment, but it's a collaborative project that I've been working on with Robert Wood Johnson, as well as CDC and others at NIH. Excuse me. And then finally, I'd like to just look at some of the benefits for public health in using this methodology and why it's, I think, been so well received. As I said, I want to share kind of some detail, and I'll go into more specifics on this experience that was the groundwork and the cornerstone for the development of the SSA methodology. And what I want to do is just kind of give you some overviews of what the process consisted of and kind of the nuts and bolts of it, and then the other examples I'll be more brief on. The first process or big major step is convening a panel of experts to identify and even review what potential policies, programs, interventions that are out in the field that you're interested in looking at. And in this case, it was community-based obesity prevention efforts. The next step, if I can call it that, was assessing those programs and policies' readiness for evaluation, which Laura just summarized with you on why, the value of doing that. Then you synthesized, or we synthesized the findings and shared those promising practices with the field. That was a major outcome and effort within this process. And then something that we were a little bit surprised or just didn't anticipate, but looking back on it, ended up being a big product of working on this, project and through this process together, is that it developed a whole network of professionals with the skills to actually conduct evaluability assessments. And as Laura mentioned earlier, a lot of people misunderstand the distinction between what an evaluability assessment is and a true evaluation. And so in that sense, it was really a benefit and product from this project. And then finally, it allowed us to inform the numerous funders that are available, whether they're national or other private foundations, of what policies and programs really are ready for evaluation, and therefore, so that they're not investing in efforts or interventions that really won't be paying off very well. So just to kind of refresh those, for those on the phone who are not familiar with the systematic screening and assessment method, actually, I need to ask folks to put their phones on mute. There's some background noise going on. Anyway, just the steps, you can read, there's lots of information on this particular slide, but basically first it's to choose the priorities for the area of interest that you have. You do a scan of the various interventions that are going on in the field, or an environmental or landscape assessment of those programs and interventions. Next, you review and identify interventions that warrant actually conducting an evaluability assessment or an evaluability assessment, and then the evaluability assessments themselves of the priority interventions. And then once those assessments are completed, you review and rate them in terms of their readiness for evaluation. And then you use that information. You don't stop there. And that's the thing that I think a lot of efforts don't give sufficient time to, because you're using that information for the programs themselves, and I'll talk about that a bit in terms of TA and whether it be around the implementation of a program itself, and or if it's technical assistance on how they should be going about an evaluation if they proceed to, desire to do that. And then synthesize, the final step is synthesizing all of that information of what you find and sharing it with the field so everyone benefits from it. So the first, step in this process is really the screening of all these programs that are happening in the field. And so we convened, excuse me, and used an expert panel for that process and shared with them all the possibilities, the things that were happening in the field, but they looked at them in terms of potential impact, the innovativeness of the intervention, the reach, the acceptability to stakeholders, the feasibility of implementation itself, the feasibility of adoption in other settings, the sustainability of that intervention, and then finally the generalizability and transportability of an intervention to other settings and other populations, and then actually what the staff and organizational structure was that supported that intervention. And as I said, this particular effort was quite large. We had it's 458 nominations of various types from the field. The types were after-school programs and daycare center programs, food access initiatives. There was a number of local school district, local wellness policies, as well as comprehensive physical activity policies, and then various interventions around the built environment that were intended to increase physical activity. And so of these 458 nominations, once the expert panel reviewed them using the previous criteria that I mentioned, it got whittled down to about it got whittled down to 174. And then of those 174, a deeper review of their materials, their documentation, and et cetera, of really what was there, and the possibility of them even hosting a site visit to conduct an evaluability assessment got whittled down to 53. And the thing that I want to point out to you is this is almost, from a total of 458 potential interventions, it got whittled down very quickly down to 53. I mean, that's basically about 90% of them got taken off the table that they weren't even ready enough or had substantial documentation to even have an evaluability assessment. So that's just where we are right now in this point in the process. And so if you think about it financially, that's a lot of money saved right then and there. The evaluability assessment itself that was conducted on those 53, as I mentioned, had an in-depth review of all their documentation, and preliminary draft logic models were developed for each one. There was a 2 to 3 day site visit that was scheduled that included interviews of all the various staff and key stakeholders, and during those interviews, the logic model was discussed and refined. There were conversations around their current staffing, their future staffing, as well as funding and sustainability of the program, or if it really was just a one-off. And then there was physical in-person observations of the interventions themselves. And then finally, there was a debriefing session with those key stakeholders at the end of the site visit, and some on-the-spot technical assistance was provided. One thing I want to share with you is during those site visits, even though we had whittled down the nominations down to 53 and thought we really had hit on some wonderful potential interventions, there was, I don't remember the exact number, but at least 3 where in conversations with the stakeholders within even a day's time, the site visitors themselves realized that it was a bust, that there was something was not right with the dynamics of the staff, or there wasn't the data that they said they had available, the quality was so poor that it would never warrant or sustain a rigorous evaluation of any kind. And so those site visits were terminated right then and there, and the site visitors returned home. And that surprised us, to be quite honest. That was something that we did not anticipate, but then became ready as this happened a couple times, got more prepared for, even in our training of site visitors, to have have their eyes open for those types of scenarios. After those site visits, excuse me, the site visitors came back and immediately wrote up summary reports and recommendations for that site. Those recommendations were around the actual implementation of the intervention themselves, as well as recommendations for the potential to be evaluated. Including those, or in addition to, I should say, those reports, we actually conducted a technical assistance call with additional CDC experts for that particular type of intervention. Now, I know that that's an unusual circumstance because we had the staff and resources at CDC to do that. And we have experts at CDC that are, have wide arrays of expertise. And so this call, this technical assistance call, and even subsequent emails and that kind of thing over the, subsequent months might not be as readily conducted or pulled off in other scenarios with other folks. But this one piece, this kind of feedback loop and follow-up with the sites themselves was highly valued by the participants. And if nothing else, that was the one thing that they really, really appreciated for all the time and effort that they gave us through this process. Okay, my slide, oh, there it goes. All right, then now we have completed all those site visits on those 53 sites, and so having all that information, the next step is the determination of readiness for evaluation. And so those reports were used in conjunction with conversations with our expert panel to actually classify for each intervention whether they were ready for a standalone outcome evaluation, whether they were appropriate for a cluster type evaluation. Third, if they were theoretically sound but needed further development, which is what Laura Levitin mentioned, is that oftentimes the interventions or programs really need to have some developmental work before they move further. And then fourth, whether specific technical assistance was needed in a specific area, even beyond what had already been provided. So the big payoff for that whole effort out of those 400 and some odd nominations was the selection of the New York City child care policies. This was a situation that was quite unique in that New York City had implemented really at that point in time some relatively dramatic policy changes in terms of their nutrition, physical activity, and screen time for every single licensed child care center in their city. And fortunately, because this project was conducted in conjunction with the Robert Wood Johnson Foundation, they were ready to fund this full and rigorous evaluation. So therefore, then the positive evaluation of implementation and outcomes were found that these policy changes did actually do what they said they were going to do. This effort resulted in the largest sample of centers, really, of low-income urban neighborhood populations for New York City at that time. And as a matter of fact, I don't think any study has been conducted since then that is as large. The outcomes were actually verified with direct observation and accelerometry for the physical activity and direct observation for any food intake. And then this study has now become the reference study for lots of national recommendations for child care center policies and practices. And so it truly paid off that every dollar that was spent on that evaluation was worth it, if I can say it so bluntly. Moving forward just to some other examples of what has resulted from the development of the SSA methodology using evaluability assessment is within my own division at CDC. We have very, very limited funds to conduct evaluations and any kind of research at all. And so we are extraordinarily vigilant and cautious when we make those investments. But seeing the productivity and the possibilities of using this methodology to really zero in on interventions of high quality, we have done this actually a number of times, but the one that I'm sharing with you right now is they've used it to identify innovative policies and practices related to public property shared and open use agreements, such as school properties with joint use agreements or swimming pools and then even public parks. They've used that opportunity to identify the best promising practices that are feasible for state and local implementation. They have focused in their selection on interventions from communities with very few resources, which is always an issue in terms of dissemination, is that oftentimes, you know, the big urban communities have access to resources that lots of the smaller rural and or even suburban communities don't. And so these are interventions that can be implemented almost anywhere with very little financial support. And then one of the final products are that there are a series of fact sheets on all these successful policies and strategies. And so it's really resulted in some very beneficial tools for the field. The next example that I want to share with you is out of our Division of Heart Disease and Stroke Prevention, and they have actually really taken on this or adopted using this methodology. As a matter of fact, to date, they have actually conducted 7 major projects that have been related to hypertension control. Again, I've got to ask people to put their phones on mute because there's some background paper shuffling going on. They are in a very fortunate position. Number one is that hypertension control tends to happen in conjunction with health clinics, and so they have, those health clinics have very sophisticated abilities in terms of data collection, and the quality of the data that they collect is probably about the best you can get. And so they've taken the SSA model and even developed what they call the new enhanced evaluability assessment. Depending on the actual topic area and the amount of evidence that they have for that topic area, they actually interchange these two methodologies. They conduct the SSA for the rapid assessment, but then immediately upon finding an intervention at a particular location or system, if I can call it that, because oftentimes it's a healthcare system at multiple locations, they have access to the data to actually conduct what I would call a quick evaluation even. So they've done the evaluability assessment and said, yes, everything's a go, and they're right there on the site, and they conduct and design an evaluation that can be conducted within a matter of maybe 1 to 2, maybe 3 months. And so they can get to final results quite quickly. And this has been written up and is published in the Preventive Chronic Disease article that I've got listed down at the bottom. But this is a very unique situation where they have data of such high quality at these locations, which is often not the case in what I would call more community-based or community-driven interventions, that they can actually kind of take it from beginning to end much more quickly. And then the final, another example, not the final one, but another example is, this is from the National Center for Injury Prevention. They have used this a number of times, but the one that I thought was kind of unique is there is a strategy that they use for post-traumatic brain injury students, and it's called the Return to School initiative. And what it is the best practices for return to school are if a student has sustained a brain injury and they need post-injury support at the school, this is a curriculum, it's staff instruction, it is education of the physical activity instructors at that school, and or even the families themselves who need to learn about resources, whether they be medical and or community-based resources for their child that has had a traumatic brain injury. And so this is what they did is they conducted an SSA with the goal of identifying what are the best program models and what are the best program components for understanding all the outcomes that can occur with these injured individuals. They focused on models for scalability and applicability in all 50 states because their aim was to create a national recommendation for schools. And then the other goal for them was improving the identification and management of the injury itself, of a traumatic brain injury in the healthcare system and or schools. For instance, if a child is in a physical education class and is injured, that those teachers may not recognize the symptoms of a concussion and or any type of brain injury. And then similarly, healthcare systems, if you just go to a pediatrician, you know, as your primary caregiver, oftentimes they're not aware of what to look for in terms of concussion and or brain injury. And so this is, they also wanted to identify models that would help with that identification and management. And then finally, this is the last example I want to share with you, and this is something that this is a project that I've been working on at CDC along with colleagues at Robert Wood Johnson Foundation, and we use the SSA methodology, but not to identify sites that needed evaluation. We actually used it to identify sites that claimed to have been evaluated and that they claimed to have good outcome data, and in this case it was for obesity declines at a community level, and so the outcome data happened to be body mass index and obesity prevalence values. But quite honestly, there was questions in the field of whether or not this data was actually valid, whether their collection methods were, you know, appropriate, and there were all sorts of questions about whether these declines in BMI were really true. And so what we thought about is using the same method, but instead of using the site visit as an evaluability assessment, it was a site visit to confirm that the evaluation results were accurate. And so we used the same process, excuse me, but the questions were different. We used the SSA method as a confirmatory process for the outcome, and then an exploratory process for what happened that once we confirmed that the BMI truly was valid and that the decline was true, we wanted to know what happened in those communities that could have influenced, supported, and even caused that BMI decline. We realized in this process we couldn't actually get to causality, and so that was something of the exploratory process that we learned, but that was important to know too. And as it turns out, there ended up being 4 communities throughout the United States that did have valid declines in BMI, and what was fascinating is that there were very similar patterns of a whole cluster of interventions that were occurring in the communities, and as well as programs within those communities that led to these anticipated outcomes. And that is to be published in the near future in the next number of months, and so I can't give you lots of specifics on that, but I can just tell you that the methodology worked to help us get there. So just to recap, again, SSA and evaluability assessment is a process. You have to first go back to choosing your priorities, for your actual scan itself, conduct the scan, then you review and identify that warrant an evaluability or a confirmation, as in the Obesity Declines Project. You conduct the actual evaluability assessment itself. You review and rate them for readiness and promise. And then the biggest thing is you use the information. whether it is to conduct a rigorous evaluation, giving feedback to the stakeholders and the program implementers, whether it's cross-site synthesis, whether it's TA back to the field itself, and even the experts on the panel, you know, in terms of helping the field grow. So this is kind of the transition in what I want to share with you today is that why is SSA so important? I mean, you know, it adds value. I mean, bottom line is SSA adds value not just for a singular intervention, but it adds value for the field. The evaluability assessment, as it says on the right-hand column in terms of being different, is one component of the process of discovery. But this complete, comprehensive, systematic screening and assessment methodology explicitly provides feedback to the innovators and stakeholders. It provides insights on clusters of projects and, you know, in a particular focus area. And it has been proven over and over and over again that it does identify policies and programs worthy not only of further attention, but of evaluation and review. So just to kind of sum up, and I realize there's a typo in the header of this slide, so I apologize. But SSA does allow us to find the best faster. I mean, remember, we started with 458 nominations. We whittled it down to 174 in terms of inclusion criteria. But then, again, that was whittled down to 53. And the big payoff here was that after conducting those evaluability assessments, in the obesity declines, the obesity prevention study that was kind of the original project for SSA, we identified 27 that were ready for standalone evaluation. And so I can't reiterate enough, you know, if we invested in every single one of the 456, or even if you said the 174, there would have been millions of dollars wasted. Whereas by identifying the 27, we have you know, a substantial likelihood of finding solid outcomes, positive results that can build the field better and quicker, and it's just a phenomenal process that I think a lot of people and agencies can use. So it is cost-effective for funders and disseminators, and it reduces all the uncertainty that often, particularly funders, have about evaluation investment, and even, I would say, researchers in terms of them spending their precious research time on evaluating interventions that will just not pay off. So we have this, I like the method, is that without this systematic process, one would need to conduct at least 20 evaluations to discover one that might be successful. So to wrap up, we have experts and practitioner innovators found this process a very beneficial experience, and they learned a lot. One of the things that I think Laura Leviton and I were really impressed with is when the expert panel gathered, and I've heard this multiple times in now other situations, that gathering experts together that have different focuses of expertise, and when they have to make these joint decisions of which, you know, intervention is worthy of an evaluability assessment, they learn so much from each other and about other types of interventions outside their kind of realm of authority that they find it extremely valuable and beneficial, and that finally another big payoff that is not the evaluation itself, but that conducting and going through this process of evaluability assessment plays a role in program development, this overall ability to have touch points with programs in the field, with those stakeholders, with the implementers themselves to provide technical assistance, whether it's on that, if that technical assistance is on the content of the program itself and or evaluation. It just can't be understated. And with that, I think I am, whoops, slides, there we go. The impact on the field, we have themes and issues that have emerged from the clusters of policies and programs that we found. The evaluability assessments themselves can be configured to cast new light on developments for the field. Researchers, again, as I just mentioned, were really fascinated what practice is doing, and so even the process itself of gathering them together was beneficial, and so therefore then stimulated lots of discussion for new research agendas. And I think that is it.
That's great. Thank you very much. A big pleasure to have you both presenting on evaluability assessments. So thank you very much, Laura Leventon and Laura Kettle-Kahn. That was a great overview of the assessment and the different ways that they were used. It's great to also see the scope of this and how people can use this in practice. So we'd like to open up the session to Q&A. So please post any questions or comments that you have for our presenters in the chat section, and then I'll read those aloud to our presenters. So I think I just saw one question that was posted, or two actually. We have one from Brett who mentioned that, and I think this is for Laura Leventon, that you described that logic models or theory of changes should be created or revised. Is it more of an and rather than an or for development of each of these tools?
I would say that he already knows the answer, or should I say we are in agreement on the answer, which is that it's and. Both of the tools are extraordinarily helpful to visualize for people what it is that we're talking about. And in addition, I would say that you know you're on the right track with these logic models and theories of change when people are very eager to revise it, because it means they're engaged in the process. By the way, can you hear me all right?
I can hear you great, thanks.
Oh, good. So it's sort of like the old thing about promises or pie crust made to be broken. This is very similar. I mean, at some point you hopefully you reach a point where people are in agreement as to what the model looks like and you can go forward. But the very process of thinking it through is oftentimes really valued. In fact, surveys of nonprofit organizations indicate that the part of evaluation that they generally appreciate the most is if a good logic model or theory of change emerges, because that's something they can refer to, they can revisit, they can share with others, potential funders, and so forth. Anyway, I hope that's sufficient and responsive.
That's great, thank you. I'm just passing along a thank you from Brett as well for your response.
Sure.
And another question that I'm seeing from Bryce, who's asking if you have any references for the theory of change template.
Yes. First of all, I would be surprised if our Chapter 3 of the New Directions volume doesn't have some. But you'll also find some good ones just on the web. And a good original resource for theory of change is Carol Weiss's book on evaluation, the second edition, where she talks fairly extensively about theory of change.
That's great. Thank you very much. And we have one more question coming in who's asking, from Lori, who's asking how long and how many resources may evaluability assessments take?
Well, I'll start with that and then turn it over to Laura. I have done, at this point, well over, or overseen well over 100 evaluability assessments of the standalone variety. And they ranged in cost from nothing, except the time of teams of Masters of Public Health students to conduct them, to around $35,000 or $50,000 a piece. And what I can tell you is that even the most dysfunctional of these public health student teams did a pretty darn good job. They offered value to the agency that they were conducting the project with. And that was also a big surprise, which really led very nicely to the use of the evaluability assessments for the technical assistance and development function that Laura Kettle-Kahn referred to. For a $50,000 project, you should expect some supremely good work. I would not pay that much unless it was for something that was either nationwide in some respect, let's say very highly politically visible across Canada, or if there was some very, very complicated set of issues that required content expertise. Let's say you were doing something on quality improvement in medicine for neurosurgery. Well, you know, that might increase the cost. But it is extraordinary who can do this well, as long as they have some guidance and training. And some consistent feedback. I mean, my student groups would come back from the field and they would really need me to use me as a sounding board for what they were discovering and what needed to happen next. That was equally true for a project we did with paramedic training, where one of the physicians that was on their advisory board was participating. She was horror-struck at what the kind of training that they were receiving, and she couldn't get beyond that until I said, look, it's what is. Now, what are you going to suggest to them for what can be, right? And, of course, the one with the inner-city arts program, what do you tell people? You know, well, you know, they can't seem to reach agreement on this, but you might want to proceed with testing the program reality, because it might tell them more about which of their many goals are achievable. So I would say that a variety of people can do this, but they need to have somebody supervising or guiding the process that's been through the process before.
Yeah, this is Laura Kettle-Kahn. The one thing I have to say about the cost and that kind of thing, the one thing that I've noticed is that, like when the community-based obesity prevention effort that was so large that CDC worked on in conjunction with Robert Wood Johnson, where we had, we were reviewing 458 potential, nominees. I mean, that was a huge effort. Just even to find them, to find the nominees, and so that took time in and of itself. Whereas most of the examples that I shared with you that others have implemented were nowhere near that scope. The field, or if I could say the scope of nominations like I know for the healthy living active or healthy eating active living example, where they looked at policies for shared and joint use agreements in various community settings, the scope of nominations was maybe 50 total, I mean, just to begin with, and so it was whittled down very, very quickly. And so the actual numbers of site visit / evaluability assessments they had to conduct was less than 10. I think, as a matter of fact, if I'm remembering correctly, it was 6 or 7 site visits. And so the cost is all relative to that as well. I mean, the one thing that I think people tend to forget in their mathematics and calculation for cost and time and effort is doing that initial scan of, you know, what's out there. That sets the precedent, number one, but reviewing all those documents, summarizing them, you know, so that you can start, you know, making selections and stuff if your field is large. I mean, is really, that takes some time, but it can be done in-house. It's not like you're leaving your office to do that. And so it's pure staff time in that sense. And so the examples that, for instance, if I stay on track with the joint and shared use agreements, I think their budget to do that whole thing was like $75,000. For the hypertension control studies, I really don't know. I could find out for you, but remember those particular studies actually conducted an evaluation as well, kind of what I call a mini confirmation evaluation. It wasn't a full-fledged rigorous evaluation by any means, but it was at least a confirmatory evaluation that the interventions they were finding were actually successful. And I truly don't have any idea what the costs of those were, if that's helpful.
So just to recap, the standalone, single, one at a time, here it is, do an evaluability assessment, that is exceedingly low in cost.
Right.
From zero to 50,000. 50,000 should get you a heck of a deluxe one.
Yeah, that would be really, really high.
So for the kind of star search that Laura is describing, we call it sometimes a research funnel. That's where it can be more labor intensive and costly. But as she said, and it's news to me, frankly, Laura, thank you very much for the information, it doesn't have to be that expensive. Very interesting.
Mm-hmm.
That's great. Thank you very much, Laura, to both of you, Laura. That was a great overview, especially given the different types of situations. So that's really great. So I'm not seeing too many more questions, although we will, we do still have more time. So if participants do have more questions, please feel free to post those in the chat section.
While they're being posted, let me take this opportunity to gush just a little bit about the quality of evaluation that I've seen coming out of Canada. Historically, you all have really been good at this. And so I just wanted to recognize and acknowledge it and to thank you for setting a good example to others.
Yes, and so willing to share and collaborate too. I mean, you guys are the best.
Well, thank you very much. I'm sure I definitely appreciate hearing that, and I'm sure the rest of our participants do as well. And I know that the work that the both of you have done and shared with us today definitely helps very much and helps to bring the different groups together to discuss this. So it's great to have this platform to have you present. So we put up another polling question here for participants to respond to again in WebEx, and just remember to hit submit when you're done. It's great to see that quite a few participants today have said that this method or tool could be very useful in their practice, so that's great to hear. And hopefully we can see a few people using this in practice soon. So again, your feedback to our participants is very important to us. We've posted a link in our chat section, so please take a few minutes to complete the survey and provide any feedback that you may have on this tool and our whole Spotlight webinar series. We welcome any feedback, and we really use this information to help inform the webinar series itself and select methods and tools to feature in our future sessions. So again, that short survey will be posted in the chat section as well as on the slide. So now we're just wondering what your next steps might be. So this question is a little bit different than the ones previously. So we invite you to select any of the options that apply to you and then hit submit. So it may be accessing the method or tool referenced in this presentation, reading the NCCMT summary about this method or tool, consider using the method or tool in practice, or telling a colleague about this method or tool. So we'll leave that polling question open for you for just a little bit longer. And we'll invite you to share your story. So if you're working in, if you're using EIDM in your practice, we want to hear about it. Send us an email. We'd love to hear how you used EIDM in your practice. And if you need support for EIDM, please contact us if you have any issues or if you're looking for help. So our nccmt@mcmaster.ca email is posted in the chat section for you. So our next Spotlight on Methods and Tools webinar will be on Thursday, January 25th. So we'll be on hold until the new year, and we'll be featuring EENet. And this is a mental health and addictions knowledge translation resources. So we'll have a presenter from EENet and 3 different user stories showing how these tools and resources have been used in their practice. So that should be a really great session. We look forward to the new year for that. And any other information on our other webinar series from NCCMT can be found on our website. So our topic-specific methods and tools webinar series, our online journal club, and our peer-to-peer webinars. So just looking through the chat section, I'm not seeing too many more questions. So Laura and Laura, I'll pass it to you if you have any final words for us today.
I have none. I'm amazingly gratified at where these techniques have gone for public health in the United States. And Laura Kettle-Kahn's presentation really illustrated that, and I'm no end grateful that that could happen.
Well, I just want to say well, I'm very grateful it's been well accepted and being used, because to be honest, I think the quality of evaluations and stuff that are occurring have greatly improved because of SSA. But the other thing I want to share is, please, I mean, if any of you want to contact either Laura or I, do not hesitate. We're passionate about this methodology and would be more than willing, to reach out and help in any way we can. So at least from me, Laura, I'm volunteering you, but definitely on my part, definitely reach out, because I'd be happy to work with you, or at least try to point you in the right direction for others that have done this, and be as helpful as possible.
I certainly agree.
Thank you very much to you both. That's great to know that you're a resource for us and for others who have questions. So with that, I'd like to thank everyone who joined us today, and I'll pass along any questions or comments that you have if they're directed to us, and can forward those to our presenters. So thanks again for everyone who participated. It definitely makes for a really great discussion and to hear about all your stories. So thank you very much, and we hope to see you all in January. Have a great afternoon, everyone.
Good night.
Bye.
Bye-bye.